Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry and promotes the highest standards of patient care with today's top experts in the field. Now here's your host, Dr. Joel Berg.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. Brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg. And thank you to our Pedo Teeth Talk sponsor, Hugh Freedy, for helping us bring you great content. We couldn't do this without them. Visit them at www.hughfreedy.com. That's HU-FRIEDY.com. We are here today with Mary Lee Conicella. Mary Lee is Aetna's Chief Dental Officer and oversees dental clinical initiatives, policies, and claim review. She is a member of Aetna's Medical Affairs Leadership Team, focused on driving member engagement and positive health outcomes. She was instrumental in creating Aetna's Dental Medical Integration Program and has published numerous abstracts and articles related to the impact of dental care as a holistic health achievement. She has helped develop several initiatives to reduce dental opioid prescribing. These programs received global recognition in the groundbreaking NIH report, Oral Health in America, Advances and Changes. Dr. Conicella received her DMD from Temple University and is a fellow in the Academy of General Dentistry. She is a member of the National Association of Dental Plans Board of Directors and the National Dental Association's Corporate Roundtable. The Aetna-NDA Partnership for Achieving Racial and Ethnic Health Equity, published in the American Journal of Public Health, describes her extensive work with the NDA to help and support interprofessional programs that improve health for vulnerable populations. Mary Lee, thanks for being with us on Pedo Teeth Talk.
Thank you so much for having me. This is a really exciting podcast setup. It's so cool to be here in the middle of the exhibit hall, so I'm really enjoying it.
Well, I appreciate you being here. You know, when we saw you were on the program, and I think you spoke yesterday about teledentistry, I said, well, they told me and I told them we have to have you on the program. We're grateful that you agreed to do it. And, you know, we're going to talk today about the future of dental benefits, which is a very interesting subject. All of our members want to know. You know, I mean, dental benefits is something that I'm not an expert on. I don't own a practice. I practice in other offices, but dentists quickly become kind of experts on that. It's a moving target, but the future is bright, and that's what we want to hear about. But before we get into that, maybe tell us, you've been with Aetna for some time as the Chief Dental Officer. Tell us a little bit about that journey, how you got into that, and, you know, we just heard what you do, but maybe some things that we might not know.
Oh, gosh. I celebrate my 25th anniversary at Aetna this coming July. So it's exciting to make that milestone. I've been in this Chief Dental Officer role a little over 10 years. And the journey was, I was practicing general dentistry with my husband, who's here at the conference.
Oh, great.
Bruno. Shout out to Bruno. And I was also teaching at Pitt Dental School. Mm-hmm. And Aetna opened a big dental service center in Pittsburgh, where I'm from. And
so what does Dental Service Center mean?
It means a center where they process dental claims.
Okay, got it.
And they were hiring a clinical team to review dental claims, and I was intrigued by that. And I applied, and they hired 7 full-time dentists. And I later found out about 70 applied.
Wow.
I felt like I was going to the dark side. I didn't tell many of my colleagues about the job. But
was it a full-time job?
It was a full-time job, which I didn't know. I thought it would be part-time, and I didn't know it was full-time until I interviewed. But it was really fun. For a long time, I did all 3 things. So I actually worked for Aetna 4 days a week. I still taught at the dental school 1 day a week, and then practiced when I could in the evenings or the weekends. So it was a fun journey. I was really lucky because my husband was still practicing in our practice. It wasn't like I had to make a decision to give up a practice.
Got it.
To do my Aetna job.
Oh, that's fantastic. So how does your role evolved in Aetna? You're Chief Dental Officer now. What kind of transition did you make from that role reviewing claims, which you're still responsible for, but
right.
How has your role changed to the present?
It was a gradual change. I loved reviewing dental claims. I still find it so interesting, but it was just kind of a leadership transition. So I got responsibility for our Pittsburgh team, and then I took on responsibility for a team that we had in Grand Rapids and then Albany. And so it was just sort of an exceedingly more robust leadership role that eventually brought me to this chief dental officer role, where now I have responsibility for our relationships with organized dentistry, like AAPD or the ADA or the NDA, and also with our customers.
Yeah.
So I get to travel and visit with customers, which is really important because it gives us a window into what do employers want in a dental plan and what do our members want. So that's a cool perspective to have.
That's fantastic. This is when our listeners hear this, they're going to be interested in this kind of career. I get questions all the time about other career options, and I bet if they advertise for those 7 positions today, you'd have more than 70 applying.
You're probably right. And we can use some younger dentists in the profession. Typically, most of the carriers will require about 10 years of clinical experience, but that still yields a pretty young dentist.
Yeah.
So,
well, I'm glad you got the job, and I'm glad you took it, because look what's happened since then.
Thanks.
So let's talk about the future of dental benefits. We won't talk much about the present, because that's another different and maybe longer conversation in some ways. So what is the future of dental benefits? Where are they going, and what do we need to know as providers?
Well, I think there are some themes. So cost transparency is kind of a buzzword now, and consumers want more cost transparency in their dental plan. So from the benefits side, they want to know what's covered in my plan. I need to know more information about how this plan works. They're also looking for more cost transparency in the procedures they have. So dentists all need to be aware that more and more their patients will be asking questions and will be concerned about cost. Data access is another theme. So more and more patients want to have ready access to their own data through an electronic health record, and that will include dental EHRs.
So that's kind of like what's happening in medicine. If I go to the Mayo Clinic and I have an app, and if I get labs done, I can see in 4 hours, I can read every clinical note. Is that what you're talking about?
Yeah, and so like at Aetna, for example, we have medical and dental, and in our Aetna Health app, you can access all of that data.
All together?
Your dental yes.
Can you see the clinic notes?
Yes. So we're lucky.
Dental. Wow.
Yes, we're lucky that we have all of that on the same platform.
That's exciting.
But that's something that will be increasingly more important to patients.
I love that.
Convenience is really important. Customers in every sector of capitalism are looking for more convenience, and so for dentists, that means they'll want dentists to have more evening hours or weekend hours. We are seeing more of a demand for mobile dentistry, being able to access dental care in non-traditional ways, maybe being able to access dental care at your work site. And then I talked about cost transparency. There's definitely more focus on costs from the employer side. So employers really have to deal with the rise in healthcare costs across the board, and dental benefits are supposed to be simple and not as expensive as medical benefits. And employers are increasingly thinking about self-insuring, so taking on the burden of the risk themselves. And when employers self-insure, what that means for a dental plan, and I think your listeners really need to know this, employers are choosing what the dental benefit plan design looks like. So it's not the carrier, it's not Aetna saying we cover this or we don't cover that. We have hundreds of plans that cover a bunch of different things, and it's the employer choosing.
And these are self-insured employers,
right?
They're buying.
That's
is
becoming
that another
more common.
Transition? Yeah,
yes.
like 30 years ago, we had indemnity plans. The risk was borne by the insurance company. Now that risk is borne more by the payers, which are of the plans, right? That's a big change. So what else is going to happen in the future with benefits?
I think, like, looking at all of those themes, I think patients, so your patients, our members, will just be overall more active in their own care. So, and that goes for utilizing their benefits and also utilizing services in the dental office.
Very interesting. We will now pause for a word from our sponsor.
Do you need additional CE hours but don't have time to travel to courses? Did you attend the annual session and want to listen to the audio recordings? Check out AAPD's Education Passport, an online learning center, where you can earn CE and listen to audio recordings from all of our continuing education courses and more. Visit educationpassport.aapd.org.
We are back with Dr. Mary Lee Conicella. We're talking about the future of dental benefits. I'm pumped up already because I love the fact that you just told me, I wasn't expecting that I'm going to be able to access my dental notes in my app like I can my medical. Wow, I want to sign up today just for that. And I also love in hearing from you, Mary Lee, that it's very customer focused. It's very focused on what the marketplace demands. And as a business, you need to do that, but it also it helps people more because they're asking. You always prefaced your comments with patients are asking for, and I like that. So thank you for that. That's really exciting. So I want to shift a little bit, and we'll get back to the dental benefits again. But, I was excited to talk to you also because, CVS Pharmacy merged with Aetna a few years ago, and now you're this behemoth called CVS Health. And I think it's like the fourth largest company or something like that. It's a gigantic, like close to $300 billion in revenue. It's unimaginable for dentistry to have such a big company. And I learned as I was prepping for this with you how much product CVS sells through the pharmacy that are oral care. So as we transition into medical management of disease, it's going to be the CVS Healths of the world selling those products so that you get the full circle of the benefits part you just talked about, improving your health, looking at your app, self-care, and then closing the loop with the product side. So how has that acquisition by CVS of Aetna impacted these initiatives and other initiatives?
It's really exciting. Now that we're a part of CVS Health, we can utilize CVS's 9,000 plus retail locations as what we like to call the new front door to health. And there are 60 million Americans who live in dental deserts where they don't have easy access to a dentist, usually because of geography. And so most of those 60 million Americans do have easy access to a CVS retail location. And it allows us to offer, I was talking about mobile dentistry. We can offer mobile dentistry in our Health Hub or Minute Clinic locations. Or a lot of what we're focusing on is caring for our members the other 363 days of the year. So they have 2 dental visits a year. We care about their oral health those other 363 days.
That's music to my ears right there. Yeah,
well, and you said this earlier in your course, that home care is going to be a big part of medical management of dental disease.
All the other diseases do that.
Yeah. And so you made the point, CVS sells oral care products, and they definitely have what I see, even over the last almost 4 years that we've been a part of CVS Health, is that there is an increased focus on oral health and oral care products. And for example, we're now offering a discount on all CVS oral care products to all Aetna members, not just Aetna dental members, but any Aetna member. So we want to make it easier to get access to oral care products so that you can really pay good attention to your home care in addition to getting regular dental visits.
So regarding, we talked about it a minute ago, that there's a growing trend towards these employers, big employers, who are paying for the dental care, not you, the insurance company. They're bearing the risk. They're self-insured. What are your conversations with them like? What are they saying about improving oral health, self-care? What do they have to say about all that? Are you advising them and then they're following, or are they actually saying, no, are they leading a little bit?
I think it's a little of both, but they're definitely leading more than they were 10 years ago. When I first started really meeting with clients in the last 10 to 15 years, now they're much more knowledgeable. They're definitely getting the message of how important oral health is to your holistic health. And I mean, they're seeing the big picture. They really care about their employees getting preventive care. They would rather spend more money and they talk to us all the time about what are ways we can get more of our employees to have those 2 visits a year. And they're willing to pay more for more preventive visits because they believe that it will not only reduce future complicated dental services like crowns or root canals, but they know that it's going to improve their overall health. They know about the connections with oral health and diabetes. They know about the connections with oral health and pregnancy. And so employers really want to see their employees getting more dental care.
I love that. So would you say if we did have some of these discoveries that we were talking about where I developed a tool that could specifically identify who's at greatest risk, they may be prone to want to pay for, to what you just said, more preventive visits, more disease management in the dental office, in addition to more home care.
I think that will absolutely be the case going forward.
That's fantastic. So you referred earlier to these mobile clinics in remote areas. Tell me a little bit more about how that works.
It works in a variety of ways. So, and I just had a conversation with a customer last week who has a couple of pockets of their employees that are in really rural areas of North Carolina, for example, where there aren't a lot of dentists. And they're very interested in how can we get easy access to dental appointments for the employees in those areas. And so they asked us about what are the different options for teledentistry and what are options for mobile dentistry. And so some of the options are we have mobile dentistry vendors in our network. So these companies that can bring a pop-up dental clinic to the employer's location. They can set up in a conference room.
Are they acting as the dental home in that sense and providing comprehensive care?
That's a great question, and I get that question all the time. Is this something, so let's say they bring a pop-up clinic to the employer's location in a conference room, and let's say over the course of a week they see 100 patients. Is that intended to be the dental home for that patient? Not necessarily, but it could be. What we like to see and what we kind of insist upon is that we want all of those patients to have access to ongoing care. Right. And so hopefully that's referral to a more traditional dental practice if there is one nearby. But if this turns out to be their dental home, that's great too, because some of these mobile dentistry vendors can provide all services.
Right.
It could also be, we've piloted this where we bring one of these mobile vendors into a health hub location. So a CVS health hub, all the health hubs have what they call a wellness room. They hold yoga classes in there. They hold educational events. We've gone in there with our little dental puppets. So thinking about pediatric dentistry, we have the little dental puppets that have teeth, and we can teach kids from the community how to brush their teeth using these puppets. We've done these events in the health hubs. So a mobile dental vendor can come and bring their little pop-up clinic to a health hub over the course of a week. And what we try to do, at least what we did in our pilot, was to use a couple of local employers and offer them the ability for their employees to set up appointments during this week-long period and come into the hubs. And so we can offer that to an employer if they don't have a lot of dentists in a certain location where a lot of their employees live. We can offer that option of coming to a health hub.
This is really exciting, and I can see how I love that you're moving in that way with the goal of improving access for those who don't have access. And then this issue of, dental home, the goal would be to make sure there's ongoing care, as you said. But I can also see how, as you mentioned earlier, how this app, this health record that migrates anywhere but it resides with the patient, is going to connect all these dots. That's really exciting. That's an exciting part. So it's not just about dental benefits. I can see how this connection with the other work all fits together. That's really exciting. So as a final note, how can dentists, we pediatric dentists in our case, and companies like Aetna, how can we work together? What do you see the future in terms of our work together?
So thinking more organically about working together as part of Aetna Dental, Aetna as a whole really values our relationships with our network providers. So Aetna Dental really values maintaining good relationships with our network dentists. And so we're continuously looking for ways to enhance that relationship and improving the provider experience, doing things like having a dedicated network relations staff that any dentist in our network can access and ask questions or talk about issues. We are constantly striving for improved self-service capabilities for our dentists. So not just making things convenient for members, but also making them convenient for dentists as well. And streamlining our contracting efforts. So making it easy to get into our network. And later this year, we're rolling out a dental advisory committee where we will invite network dentists to be a part of that committee, allowing them to have open conversations with us about issues they might be experiencing and how can we work even more efficiently together. So these are our ways we're constantly looking to improve the provider experience. But I'd say also in another organic way, we love working with dentists sort of hands-on in the community. So one of the models for that is Aetna's strong relationship with the National Dental Association. We've been a part of their corporate roundtable for over 25 years. We were one of the founding members of their corporate roundtable. And a lot of the work we've done with the NDA has a focus on interprofessional collaboration. So getting out into the community, sponsoring health fairs where there aren't only dental screenings, but also health screenings, inviting pregnant members in the community to come and bring their children, but then also have the ability to talk with nurses about their pregnancy or pregnancy issues. So we love sort of an interprofessional environment where we're collaborating not only with other dentists from the community, but also with non-dental clinicians like nurses or now even pharmacists who have a focus on oral health.
This is really great. I learned so much today. It's way more than I expected. I feel like I should get CE credit for meeting with you today.
Well, thank you.
But
for
our
that.
members are going to love
fast.
this. Yeah. Well, thanks for being with us, Dr. Conicella, on Pedo Teeth Talk. Really appreciate it.
I thank you so much for inviting me. It was really fun.
And thank you to our audience. Look forward to seeing you here next time.
Do you need additional CE hours but don't have time to travel to courses? Did you attend annual session and want to listen to the audio recordings? Check out AAPD's new Education Passport. The redesigned and improved Education Passport is AAPD's online learning center, where you can earn CE and listen to audio recordings from all of our continuing education courses and more. Visit educationpassport.aapd.org for more information. For 10% off any product, use discount code TEETHTALK in the Education Passport store. Pedo Teeth Talk is the show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry. Be sure to check out previous episodes of Pedo Teeth Talk, as well as our other podcast platform, Newly Erupted. All previous episodes are available on our website. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.